So again, here's our patient's head. Here's their torso with arms, and their heart sits right here. The next view we'll discuss is the apical views. So the probe footprint is down here at the heart's apex, apical views. And what do you see? Well, you'll see the first view, you'll see the apical four-chamber view looks like this. You see the left atrium that empties blood into the left ventricle. Show the muscle there. And then over here, you'll see the right ventricle, and you'll see the right atrium. So over here, just label these: left atrium, mitral valve, left ventricle, right atrium. I'm going to use a different color for the tricuspid valve leaflets. Tricuspid valve and right ventricle. And how do you know which is left or right? Well, the left typically larger and muscular as I've drawn, but on the right side you may see a little moderate band. And most importantly, if you look at where the leaflets insert for the mitral valve versus for the tricuspid valve leaflets actually insert a little bit closer to the apex. And so if you look at the length of your right ventricle versus the length of your left ventricle, I've exaggerated it a little bit here, but you see how the left ventricle is actually a little bit longer. So that insertion of the mitral versus tricuspid valve, that's very helpful in knowing which ventricle is which, particularly in congenital variances in anatomy. All right, so let's clean this up. And then now if you take your probe that's down in the apical four-chamber view and rotate it about 60 degrees, you'll see this view. You'll see the left atrium that empties blood into the left ventricle. So to label these, we've got left atrium, mitral valve, and left ventricle. We'll talk about this view more with wall motion abnormalities. It's helpful to be able to look from an ejection fraction. It's helpful to look from two different angles. And then if you rotate it another 60 degrees, you'll see something like this. You'll see the left atrium that empties blood into the left ventricle. You'll see the aortic valve, and you'll see the aorta. And let's just give a little thickness to the left ventricle there. And you'll see the right ventricle right up here. Now this may be familiar to you. Let me label these again. So left atrium, your mitral valve, left ventricle, your aortic valve, and your aorta. Right ventricle over here.